repair or sensitive skin, as these often use physiological lipid ratios. Timing matters less for ceramides than for some other ingredients. You can use ceramide products morning and evening without concern about sun sensitivity or ingredient conflicts. Unlike acids or retinoids that require careful timing and introduction, ceramides are gentle and supportive at any time. This makes them easy to incorporate into existing routines without complicated adjustments. Ceramides work beautifully with other skincare ingredients. They actually help your skin tolerate stronger actives like retinoids and acids by maintaining barrier strength. If you're using potentially irritating treatments, applying ceramides before or after these treatments provides protective buffering. This doesn't reduce the efficacy of your actives, but it does reduce irritation, allowing you to use effective treatments more consistently. Niacinamide and ceramides are particularly synergistic. Niacinamide helps your skin produce more ceramides naturally, while also providing its own anti-inflammatory and barrier-supporting benefits. Using products that combine both ingredients or layering niacinamide serum under ceramide moisturizer gives you enhanced barrier support. This combination is effective for virtually all skin types and concerns. Hyaluronic acid complements ceramides by providing hydration, while ceramides prevent that hydration from escaping. Think of hyaluronic acid as filling your skin with water and ceramides as creating the walls that keep that water in. Using both together creates optimally hydrated, protected skin. Apply hyaluronic acid to damp skin, then follow with ceramide products to seal in moisture. Not all ceramide products are created equal. The type of ceramides used, their concentration, the formulation that delivers them, and the presence of supporting ingredients all affect effectiveness. Ceramides should ideally be in the top half of the ingredient list to ensure meaningful amounts. Products that use multiple ceramide types tend to be more effective than those with just one type. Formulations that include cholesterol and fatty acids alongside ceramides more closely replicate your skin's natural barrier structure. Some products use plant-derived ceramides, sometimes called phytoceramides, while others use synthetic or biomimetic ceramides. All can be effective, though synthetic ceramides that precisely mimic human skin ceramides may work most efficiently. The important factor is that the product contains effective concentrations of ceramides that can actually integrate into your skin barrier, not just sit on the surface. Texture and feel matter for compliance. The best ceramide product is one you'll actually use consistently. If a ceramide cream feels too heavy for your skin, try a lighter lotion, gel, or serum. If it feels too light and you need more richness, opt for a cream or balm. Ceramides can be formulated into virtually any texture. So experiment until you find one that feels good on your skin and fits your preferences. How quickly can you expect to see results from ceramides? Unlike dramatic actives that show visible changes quickly, ceramides work more quietly. Within days to a couple of weeks, you might notice your skin feels more comfortable, less tight, and less reactive. Over several weeks, dryness improves, sensitivity decreases, and your skin simply feels healthier. After months of consistent use, your skin's overall resilience improves, handling challenges like weather changes or new products with less drama. The benefits of ceramides are most apparent in what doesn't happen. Your skin doesn't react as much to irritants. Products that might have caused stinging feel fine. Weather changes don't trigger dryness or flaking. These preventive benefits are harder to measure than dramatic visible changes, but they're incredibly valuable for long-term skin health and comfort. Ceramides are suitable for all ages. Young skin benefits from ceramides by maintaining its naturally strong barrier. This is particularly important if you're using active ingredients or your skin is exposed to harsh conditions. Mature skin benefits from replenishing ceramides that decline naturally with age. There's no age too young or too old to benefit from ceramide-rich skincare. They're also suitable for all skin types without exception. Dry skin needs ceramides to restore barrier function and prevent water loss. Oily skin benefits from barrier support that allows normal sebum production. Sensitive skin requires ceramides to build protective barriers that reduce reactivity. Combination skin can use ceramides across the entire face or targeted to specific areas. Normal skin maintains its health with ceramide support. Think of ceramides as insurance for your skin. They won't necessarily create dramatic before and after photos, but they provide the foundation that allows everything else in your routine to work better. They're the unglamorous but essential ingredient that keeps your skin healthy, comfortable, and resilient. Investing in ceramide-rich products is investing in your skin's long-term health. Consider ceramides as particularly important during times of barrier stress. When you're starting strong actives like retinoids, increase your ceramide use. In harsh weather, winter cold or summer sun, boost barrier support with extra ceramides. After professional treatments like chemical peels or laser procedures, ceramides help skin heal faster. During illness or times of stress, when your skin is more vulnerable, ceramides provide protective support. For compromised skin conditions like eczema or severe dryness, ceramide products should be central to your routine, not optional additions. Many dermatologists consider ceramides essential for managing these conditions, recommending ceramide-heavy moisturizers as primary treatment alongside any prescription medications. The therapeutic benefits of ceramides for barrier-compromised skin are well documented and significant. As we close today's session, let's take 3 final calming breaths together. Breathe in, appreciating the invisible work ceramides do to protect your skin. Breathe out, releasing any neglect of your skin barrier. Breathe in, embracing the simplicity of barrier-supporting care. Breathe out, trusting in these fundamental building blocks. One last breath in, committing to ceramide-rich skincare. And breathe out, carrying forward this understanding of barrier health. Remember, ceramides might not be the most exciting ingredient, but they're among the most important. Every day that you support your skin barrier with ceramides is a day you're investing in your skin's long-term health, comfort, and resilience. Your barrier protects you constantly, so protect it in return with the ceramides it needs to function beautifully.
Nhưng kỳ xíu nữa nha Khoa. Phút này nó ở đâu hả? chỉ xíu nữa ha. Còn bên đây nữa. Cục này nó cứng à. Amen.
Script number 73, At-Home Skincare Devices, What Works and What's Worth. It, soft calming tone throughout, approximately 1,700 words. Hello and welcome to this peaceful space. Take a deep breath in, hold it gently, and release. Today we're going to explore the world of at-home skincare devices, understanding which ones actually work, which are worth your investment, and how to use them safely and effectively. The market for at-home beauty devices has exploded in recent years. You can now buy professional-grade technology for home use, LED masks, microcurrent devices, ultrasonic cleaners, derma rollers, and more. It's exciting, but also overwhelming. Let's navigate this together with calm, informed awareness. First, let's establish realistic expectations for at-home devices. At-home devices use similar technology to professional treatments, but at lower energy levels. This makes them safer for self-use, but also means they deliver more subtle results. Think of it as the difference between a professional massage and self-massage, both beneficial but different in intensity and effectiveness. Professional treatments deliver higher energy in a controlled clinical setting with trained practitioners who can monitor your response and adjust accordingly. At-home devices trade some of that power for convenience, affordability, and privacy. This doesn't mean at-home devices don't work. Many do, genuinely. But they require consistent use over time to see results, and those results will be more gradual and subtle than professional treatments. Let's explore specific types of devices and what the science says. LED light therapy devices. LED masks and panels have become incredibly popular, and with good reason. The science supporting LED therapy is solid. Different wavelengths of light penetrate skin at different depths and trigger different cellular responses. Red light, around 630 to 700 nanometers, penetrates deeply and stimulates collagen production, improves circulation, and reduces inflammation. It's excellent for anti-aging, wound healing, and general skin health. Blue light, around 400 to 470 nanometers, stays more superficial and has antibacterial properties, making it helpful for acne treatment. It can kill acne-causing bacteria on the skin's surface. Near-infrared light, around 700 to 1200 nanometers, penetrates even deeper than red light and is particularly good for inflammation, wound healing, and cellular regeneration. Quality matters significantly with LED devices. Professional LED panels can cost thousands of dollars and deliver specific wavelengths at specific intensities proven in research. Many at-home devices claim to offer LED therapy, but use lights that aren't powerful enough or at the right wavelengths to be effective. If you're investing in LED therapy, look for devices that specify exact wavelengths used, not just red or blue. Light intensity measured in MSAM2, FDA clearance for specific claims, clinical studies on that specific device. Good LED devices typically cost $150 to $500 for handheld versions, $200 to $500 or more for masks or panels. Very cheap LED devices are unlikely to be powerful enough to be effective. For LED to work, you need consistency, typically 10-20 minutes per session, 3 to 5 times per week, for several months before seeing significant results. This is safe, gentle, and backed by science, but requires patience and commitment. Microcurrent devices. Microcurrent technology uses very low-level electrical current to stimulate facial muscles and tissues. Professional estheticians use microcurrent for facial toning and lifting, and several at-home devices now offer this technology. The theory is sound. Microcurrent can stimulate ATP production in cells, potentially improving cellular energy and function. It can cause muscle contraction, which might help tone facial muscles over time. Some research supports these effects, though more is needed. Popular at-home microcurrent devices include NuFace, Zip, and Foreo Bear. These typically cost $200–$500 and require daily or near-daily use with conductive gel for best results. Realistic expectations. You might see temporary tightening and lifting immediately after use from muscle stimulation and gel hydration. But long-term results require months of consistent use and are typically subtle. Think slightly more toned and lifted, not dramatically different. Ultrasonic skin spatulas and cleansers. Ultrasonic devices vibrate at very high frequencies to help exfoliate, cleanse, and enhance product absorption. The spatula-style devices claim to extract impurities through vibration, while some cleansing devices combine ultrasonic vibration with traditional cleansing. The evidence for ultrasonic cleansing is mixed. Vibration can help loosen debris and may improve product penetration slightly, but it's not dramatically different from good manual cleansing. These devices are relatively affordable, $30–$150, and safe, so if you enjoy using them and feel they enhance your routine, there's little downside. Just don't expect miraculous results. Ultrasonic cleansing might be slightly more thorough than manual cleansing, but it's not transformative. At-home derma, rolling and microneedling. Derma rollers and microneedling pens for home use have become very popular. These devices create tiny punctures in the skin to stimulate collagen production and enhance product absorption. Here's where we need to be very careful. Professional microneedling uses sterile, controlled needle depths and proper technique in a clinical setting. At-home devices can be risky if not used correctly. Needle depth matters enormously, 0.25 milliliters. Safe for home use, mainly enhances product absorption, minimal collagen stimulation, 0.5 milliliters. Can be used at home with caution, some collagen stimulation, higher risk if used incorrectly. 1.0 milliliters and deeper, should only be done professionally. If you choose to use at-home derma rolling, stay with 0.25–0.5 milliliter needles. Maintain impeccable hygiene. Don't share devices. Replace needles regularly and never use on active acne, broken skin, or infections. The safer alternative is a device like DermaPen or automated microneedling pens designed for home use with built-in safety features. These cost more, $150–$300 plus, but offer better control and safety. Gua sha tools and facial rollers. These are not electronic devices, but they're popular enough to address. Jade rollers, rose quartz rollers, and gua sha stones are ancient beauty tools experiencing modern revival. These tools don't deliver dramatic skin improvements, but they can provide benefits. Lymphatic drainage to reduce puffiness, gentle massage to improve circulation, enhanced absorption of skincare products, stress relief, and self-care ritual. They're inexpensive, $10–$50 for quality stone tools, and safe. Use them with facial oil or serum, store them in the refrigerator for extra cooling effects, and clean them after each use. Don't expect these tools to sculpt your face or provide dramatic anti-aging effects. They're lovely for gentle self-care and minor temporary benefits, but they're not miracle workers. At-home chemical peel devices and products. Some brands now offer at-home chemical peel systems that are safer and more controlled than traditional at-home acid application. These typically use lower concentrations of acids with built-in neutralizers or time release mechanisms. When used carefully according to instructions, these can be effective for gentle exfoliation and skin renewal. However, they still carry risk of overexfoliation, irritation, or chemical burns if misused. If you try at-home peels, start with the lowest strength, follow instructions precisely, never leave them on longer than directed, and discontinue if you experience excessive redness, burning, or irritation. Welcome, and take a moment to simply be here. Breathe in deeply, filling your lungs completely, and then release that breath slowly, letting any tension dissolve. Today we're going to explore something beautifully fundamental: how hydration transforms your skin from the inside out and the outside in. Water is life. This isn't just poetic language, it's biological truth. Your body is approximately 60% water. Your skin, the largest organ of your body, is about 64% water. Every cell, every function, every process in your skin depends on adequate hydration. When your skin is well hydrated, everything works better. When it's dehydrated, everything struggles. Let's begin by understanding what we mean by skin hydration and why it matters so profoundly. Hydration refers to the water content in your skin cells. Well-hydrated skin cells are plump, full, and functioning optimally. They communicate properly with each other, turn over at the right rate, and maintain the structural integrity of your skin. Dehydrated skin cells become shriveled, sluggish, and compromised. They can't perform their jobs effectively. Here's something many people don't realize. Hydration and moisture are related but different. Hydration is water. Moisture includes both water and oils that help seal that water into your skin. Your skin needs both. You can have oily skin that's dehydrated, producing plenty of sebum but lacking water. Understanding this distinction changes everything about how you care for your skin. When your skin is properly hydrated, you'll notice it immediately in how your skin looks, feels, and behaves. Hydrated skin has a natural luminosity, a subtle glow that no highlighter can replicate. It feels soft and supple to the touch, comfortable throughout the day. It looks plump and smooth, with fine lines less visible. It heals faster from irritation or blemishes. It maintains its barrier function effectively, protecting you from environmental stressors and irritants. Dehydrated skin, in contrast, looks dull and tired. It may feel tight, especially after cleansing. It shows fine lines more prominently, even if you're young. It may be flaky or rough in texture. It's more sensitive and reactive, becoming easily irritated by products that normally wouldn't bother it. It may even produce more oil as your skin tries to compensate for the lack of water. Now let's explore hydration from two essential angles: hydrating your skin from within through what you consume, and hydrating your skin from without through the products you apply. Let's start with internal hydration, drinking water and supporting your body's hydration from the inside. Your skin receives water from your bloodstream. When you're well hydrated internally, your blood delivers water to your skin cells effectively. When you're dehydrated, your body prioritizes vital organs over your skin. So your skin is often the first place you'll notice dehydration. How much water should you drink? The old rule of 8 glasses a day is a reasonable guideline, but it's not one size fits all. Your needs depend on your body size, activity level, climate, and diet. A better approach is to drink water consistently throughout the day and pay attention to your body's signals. Your urine color is a simple indicator. Pale yellow suggests good hydration, while dark yellow indicates you need more water. Your thirst is another signal, though by the time you feel thirsty, you're already mildly dehydrated. Don't wait for thirst. Sip water regularly. Create habits that support consistent water intake. Keep water visible and accessible. Have a glass of water when you wake up, before each meal, and before bed. Carry a water bottle with you. Set gentle reminders if needed. The goal isn't to force excessive amounts, it's to maintain steady, adequate hydration throughout the day. Coffee and tea count toward your fluid intake, though caffeinated beverages have a mild diuretic effect. You don't need to avoid them, but balance them with plain water. Herbal teas are wonderful for hydration and can make drinking fluids more enjoyable if plain water feels boring. The foods you eat also contribute significantly to your hydration. Fruits and vegetables with high water content, cucumbers, watermelon, oranges, strawberries, lettuce, celery, all help hydrate you from within. A diet rich in these foods supports your skin's hydration naturally. Interestingly, foods with healthy fats also support skin hydration. Omega-3 fatty acids found in fish, nuts, and seeds help maintain your skin's lipid barrier, which is crucial for preventing water loss. So hydration isn't just about water, it's about a balanced diet that includes water-rich foods and healthy fats. Excessive alcohol consumption dehydrates your body and skin. If you drink alcohol, balance it with extra water. Excessive salt can also contribute to dehydration and inflammation. This isn't about restriction or perfection, it's about awareness and balance. Now let's talk about hydrating your skin topically, the products and practices that deliver water to your skin and help keep it there. The key to topical hydration is a two-step approach, adding water to your skin and then sealing it in so it doesn't evaporate away. This is where the concept of humectants and occlusives comes in. Humectants are ingredients that attract water. They pull moisture from the environment and from the deeper layers of your skin up to the surface. The most famous humectant is hyaluronic acid, a molecule that can hold up to 1,000 times its weight in water. Other effective humectants include glycerin, aloe vera, honey, and various botanical extracts. Products containing humectants are typically serums or lightweight gels. Apply them to slightly damp skin. This is crucial. If you apply humectants to completely dry skin, especially in a dry environment, they may actually pull moisture from deeper layers of your skin, which isn't helpful. But when applied to damp skin and then sealed with a moisturizer, they work beautifully. Here's a simple practice. After cleansing, pat your skin with a towel but leave it slightly damp. Apply your hydrating serum or toner while your skin is still moist. Then, within a minute or two, apply your moisturizer. This layering technique maximizes hydration. Occlusives are ingredients that create a barrier on your skin's surface to prevent water loss. They seal in the hydration you've just applied. Common occlusives include ingredients like petrolatum, dimethicone, shea butter, and various oils and waxes. Your moisturizer typically contains occlusives, which is why you apply it after your hydrating products. Understanding this humectant-occlusive relationship transforms your skincare routine. You're not just slapping on products, you're strategically hydrating and then sealing that hydration in. Let's discuss different ways to incorporate hydration into your routine throughout the day. In the morning, after cleansing, apply your hydrating products while your skin is still slightly damp. A hydrating toner or essence can be a lovely first step, adding a layer of water-based hydration. Follow with a serum containing hyaluronic acid or other humectants if you choose. Then apply your moisturizer to seal everything in. Throughout the day, facial mists can provide a quick hydration boost, though they're most effective if you follow them with a tiny amount of moisturizer or facial oil to seal in the mist. Misting alone, especially in dry environments, can actually increase water loss as the mist evaporates and pulls moisture from your skin with it. In the evening, your routine can include more intensive hydration. This is a good time for hydrating masks, thicker creams, or facial oils that seal in moisture overnight. Your skin is in repair mode while you sleep, and giving it plenty of hydration supports those repair processes. Welcome, and breathe gently. Today we explore the Jade Roller, a simple, beautiful tool that offers real benefits when used correctly, though perhaps not all the miracles some claim. The Jade Roller is a handheld tool featuring one or two smooth jade stones mounted on a handle. Typically, there's a larger stone for cheeks and forehead, and a smaller stone for under eyes and around the nose. You roll these cool, smooth stones across your face, following specific patterns. Jade rollers have been used in Chinese skincare for centuries, though their recent popularity surge is modern. Understanding what they actually do versus marketing hype helps you decide if they're worth incorporating into your routine. Let's discuss real jade roller benefits. First, jade naturally stays cool. This coolness feels soothing on skin and helps reduce puffiness, especially around eyes. The cooling effect constricts blood vessels temporarily, reducing fluid accumulation and that puffy look many people wake up with. Second, the rolling massage action promotes lymphatic drainage. When you roll in proper directions following lymphatic pathways, you help move excess fluid away from your face. This reduces puffiness and bloating, creating more defined facial contours. Third, rolling increases circulation. The gentle pressure and movement bring fresh blood to your skin's surface, delivering oxygen and nutrients while removing waste products. This creates a healthy, natural glow. Fourth, the massage feels wonderful and reduces tension. Your face holds stress. Rolling releases this tension, particularly in your jaw, temples, and forehead. This relaxation benefits both your skin and overall stress levels. Fifth, rolling enhances product absorption. When you roll over serums and oils, the massage helps these products penetrate more effectively. Your skincare works better with jade rolling assistance. Now let's discuss what jade rollers don't do, despite marketing claims. Jade rollers will not eliminate wrinkles, dramatically contour or slim your face, tighten loose skin, or replace professional treatments. They provide subtle, temporary benefits, not dramatic transformation. The puffiness reduction is real but temporary. Roll in the morning, look less puffy for a few hours, but puffiness returns gradually throughout the day. Jade rolling doesn't permanently change your facial structure or solve the underlying causes of puffiness. Proper jade roller technique matters for effectiveness. Always prepare your skin first, cleanse, then apply generous facial oil or serum. The roller needs slip. Dry rolling creates friction and pulls skin. Start at your neck, rolling upward from collarbone to jaw, 5 to 10 times on each side. This opens lymphatic drainage pathways. Use light to medium pressure. Jade rollers are gentle tools, not aggressive massage implements. Move to your jawline, rolling from chin toward ear, 5 to 10 times on each side. This releases jaw tension and drains fluid beautifully. For cheeks, roll from beside your nose outward and upward toward temples, 5 to 10 times. covering your entire cheek area. Under your eyes, use the smaller roller with very gentle pressure. Roll from inner corner outward toward temple 5 to 10 times under each eye. This area needs extreme gentleness. The skin is the thinnest on your face. For your forehead, roll from eyebrows up toward hairline, then from center outward toward temples. This releases forehead tension and promotes drainage. Always roll in upward and outward directions, never downward. You're working with gravity, not against it, encouraging fluid to drain properly. How long should jade rolling take? Just 5 minutes provides benefits, though 10 minutes is lovely if you have time. Even 2 to 3 minutes focusing on puffy areas like under eyes helps. When should you roll? Morning is most beneficial for reducing overnight puffiness. Many people keep their roller in the fridge overnight for extra cooling effects in the morning. However, evening rolling is deeply relaxing before bed. Choose whatever fits your routine. How often should you roll? Daily is fine if you enjoy it, though 3-5 times weekly provides noticeable benefits. Consistency matters more than frequency. Let's discuss jade roller care. Clean your roller after every use. Bacteria can accumulate on the stone surface. Wash with gentle soap and warm water. Dry thoroughly. Weekly, do a deeper clean with rubbing alcohol. Store your roller where it won't get dropped. Jade can chip or crack if dropped on hard surfaces. Regarding jade authenticity, many jade rollers aren't real jade, but dyed stone or even plastic. Real jade feels cool to touch, has natural color variations, and is relatively heavy. Extremely cheap rollers are likely fake. While fake rollers still provide the massage benefit, they lack jade's natural cooling properties and may have quality issues. Rose quartz is another popular roller material. It provides the same massage and drainage benefits as jade, but doesn't stay cool as naturally. Choose based on preference. Both work. Some rollers have textured surfaces or multiple stones. These variations are personal preference. Smooth, simple rollers work perfectly well. Fancy features aren't necessary for effectiveness. Common jade rolling mistakes include using too much pressure, rolling downward, using insufficient product, rushing through the motions, and expecting dramatic overnight transformation. For acne-prone skin, jade rolling can help by improving circulation and drainage. However, never roll over active breakouts. This spreads bacteria. Roll on clear areas only, or wait until skin is clearer. For sensitive skin, jade rolling is generally safe with gentle pressure and appropriate products. The coolness can be soothing. However, if you notice increased redness or irritation, you might be pressing too hard or rolling too frequently. For mature skin, jade rolling is lovely. The massage supports circulation and lymphatic drainage without aggressive manipulation. The cooling effect feels particularly soothing on mature, often more sensitive skin. Can jade rolling replace other skincare? No. It's supplemental, enhancing your routine, but not replacing cleansing, treatment products, moisturizer, or sunscreen. Jade rolling is an optional extra that feels good and provides subtle benefits. Will jade rolling give you a facial workout or tighten skin? Not really. The light pressure of rolling doesn't provide enough resistance to significantly strengthen facial muscles or tighten loose skin. It's massage, not exercise. Professional estheticians often use jade rollers as part of facial treatments, combining them with other techniques for enhanced results. Professional use doesn't make rollers necessary for home care, but it does validate their beneficial place in comprehensive skincare. Jade rollers versus gua sha tools. Which is better? Neither is better. They're different. Jade rollers are gentler, easier for beginners, and less likely to cause irritation. Gua sha provides more intensive massage and drainage, but requires more technique and skill. You can use both, alternating based on your needs, or choose one based on preference. The cost of jade rollers varies wildly, from a few dollars to hundreds. Expensive doesn't necessarily mean better. A mid-range roller from a reputable company serves you well. Extremely cheap rollers are likely poor quality or fake jade. Extremely expensive rollers might be marketing markup rather than superior function. As we close, remember that jade rollers are optional tools offering genuine but subtle benefits. They're wonderful additions to your routine if you enjoy the ritual and experience, but they're not necessary for good skin health. The coolness, massage, and moment of self-care have value beyond any
maintenance. Their acne stays controlled. This suggests that excessive barrier compromise actually worsened acne by disrupting skin function. Prevention is better than recovery. From the start of acne treatment, use appropriate concentrations and frequencies, incorporate moisturizing and barrier support, and listen to your skin's signals. If your skin is becoming very dry, tight, or reactive, reduce treatment intensity rather than continuing and causing more barrier damage. Long-term consistency matters more than short-term intensity. Guide 27. Cosmeceuticals and advanced skincare ingredients beyond standard acne treatments. Beyond the well-established acne treatments like benzoyl peroxide and salicylic acid, numerous cosmeceutical ingredients support acne treatment and skin health. Understanding these advanced ingredients allows you to optimize your acne regimen and support overall skin function. Peptides are short chains of amino acids that support skin structure and function. Some peptides have been studied for acne-supportive effects through anti-inflammatory mechanisms and barrier support. Matrixyl and similar peptides appear in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and anti-inflammatory properties, reduces sebum production, minimizes pore size, and strengthens the skin barrier. At 4 to 5% concentration in serums or moisturizers, used daily, niacinamide provides noticeable benefits. It's also gentle enough to use with other actives without concern. Alpha-lipoic acid is a powerful antioxidant that penetrates both water and lipid layers of skin. It reduces inflammation, supports barrier function, and has some evidence for acne reduction through anti-inflammatory mechanisms. Alpha-lipoic acid is typically used in serums at 5% concentration, applied daily. It's generally well tolerated but can cause mild irritation in very sensitive skin. Ferulic acid is a plant-derived antioxidant that works synergistically with vitamins C and E for enhanced antioxidant protection. Ferulic acid also has direct anti-inflammatory effects. It's commonly found in advanced serums and provides additional antioxidant support beyond vitamin C alone. Resveratrol is a potent antioxidant from plants like grapes. It reduces inflammation and has some antimicrobial properties. While not a primary acne treatment, it provides useful antioxidant support. Resveratrol is often combined with other antioxidants in advanced serums. Bakuchiol is a natural retinol alternative derived from the babachi plant. It provides retinol-like benefits including increased cell turnover, collagen stimulation, and anti-aging effects without being a true retinoid. Importantly, bakuchiol doesn't cause photosensitivity or irritation like retinoids, making it suitable for very sensitive skin or as an alternative for those who can't tolerate retinoids. For acne specifically, bakuchiol is less powerful than tretinoin or retinol, but provides useful cellular turnover support. Salicylic acid analogues include beta-hydroxy acids beyond standard salicylic acid. LHF, lipohydroxy acid, is similar to salicylic acid but slightly milder, making it suitable for sensitive skin. These salicylic acid analogues provide exfoliating benefits with potentially less irritation than standard salicylic acid. Azelaic acid, beyond its use for hyperpigmentation, has direct acne-fighting properties. At 10 to 15% concentration, azelaic acid has antibacterial, anti-inflammatory, and anti-keratinizing effects. It's a versatile ingredient useful for acne, rosacea, and post-inflammatory hyperpigmentation simultaneously. Botanical extracts like tea tree oil, witch hazel, and green tea have mild antibacterial and anti-inflammatory properties. While weaker than pharmaceutical actives, they provide supportive benefits. Many skincare products combine multiple botanical extracts for cumulative benefit. These are generally well tolerated, making them suitable for sensitive skin seeking some acne support without strong pharmaceutical actives. Retinaldehyde, also called retinol, is a retinoid intermediate between retinol and retinoic acid. It's slightly stronger than retinol but weaker and less irritating than tretinoin. For those finding tretinoin too strong or seeking stronger benefits than retinol provides, retinaldehyde is an excellent middle ground. It's increasingly available in advanced skincare products. Encapsulation technology makes some ingredients more stable or less irritating. Encapsulated retinol, for example, releases gradually over time, reducing irritation while maintaining effectiveness. Similarly, encapsulated vitamin C remains stable longer and is less irritating than non-encapsulated forms. Time-release technology delivers ingredients gradually rather than all at once. This reduces initial irritation while providing extended benefits. Some treatments use time-release to deliver benzoyl peroxide or salicylic acid gradually throughout the day. Polyhydroxy acids, PHAs, like gluconolactone and galactose are gentler exfoliants than AHAs and BHAs. PHAs have larger molecular structures that penetrate more slowly, making them suitable for sensitive skin or those who can't tolerate standard exfoliants. They provide exfoliating benefits with less irritation. Using cosmeceuticals strategically enhances your acne regimen. For example, you might use salicylic acid for exfoliation, benzoyl peroxide for bacterial control, then add niacinamide serum for sebum control and barrier support, followed by a hyaluronic acid serum for hydration and a moisturizer with peptides for skin support. This multi-ingredient approach addresses multiple aspects of skin health. However, avoid the trap of skincare complexity. More products don't automatically mean better results. Focus on core treatments: cleanse, treat with proven actives, moisturize, protect, then add supportive ingredients. A simple routine with proven actives beats a complex routine with unproven ingredients. Guide 28: Acne and Mental Health, Psychological Impact and Management Strategies. Acne's psychological and emotional effects are profound and often underestimated. Understanding acne's mental health impact and implementing strategies to manage the psychological component is essential for overall well-being during acne treatment. The psychological burden of acne is real and significant. Studies consistently demonstrate that acne causes depression, anxiety, reduced self-esteem, and social withdrawal in many sufferers. This burden is disproportionate to acne's physical severity. Even mild acne can cause substantial psychological distress, while severe acne might cause less psychological impact in individuals with resilient self-image. Visible acne, particularly on the face, affects